While you're doing that, I'm just looking at the question here from Ginger. How does a high level of anti-actin on the wheat zoomer differ from zonulin? And that's really a good question. Zonulin is, high levels of zonulin are indicative of a defensive immune response that's occurring right now at the moment. Elevated levels of zonulin antibodies represents a history of continual elevated zonulin response. Elevated antibodies to actin represents an autoimmune mechanism attacking the mucosa of the lining of your gut. You've got an autoimmune mechanism going on, which may progress to autoimmune diseases, which can be microscopic colitis, it can be Crohn's, it can be ulcerative colitis. But when you have elevated antibodies to actin, that's an autoimmune mechanism that is going on right now. Okay, Michelle.
Okay, great. We'll have to keep those questions open so people can ask those. But thank you, Vibrant. I'm so honored to be here, and I always love to get to talk about this with Dr. Tom. We call it nerding out. And in clinical practice, interpreting Zoomer bundles is my happy place. I literally look at my schedule and I count up how many Zoomer interps I have for that day, and I just know that those are going to be the bright spots. I do love interpreting the gut Zoomers and the neurozoomer pluses and all the other tests, but these are profound. We have built in an hour to do that interpretation, and so I feel really lucky to get to deep dive with each patient for an hour on the test, and it's so rewarding when they say at the end of it, I finally get it. So we always start with, is that showing up, Dr. Tom?
Yes, it is.
Okay. We always start with wheat zoomer. It's just so critically important and so foundational. And I know that I'm just reiterating what everybody else has said, but in case anybody hasn't gotten that so far, 90% of the patients tested through the doctor.com who were on a gluten-free diet still have elevated antibodies on wheat zoomer, 90%. And it might even be higher than that. But it's really significant to use wheat zoomer as a report card. Can you tell I was a former fourth grade teacher? But it's a report card to see how well somebody's gluten-free lifestyle, it's not just a gluten-free diet, it's a gluten-free lifestyle is working. That intestinal permeability panel, there's nothing like it in the industry. It's a standout. And then I really think that those celiac markers and pre-celiac markers are really profound. So Dr. Tom and I are both on the same page on this, but we do not recommend that anyone adds, does a gluten challenge, adds gluten back in before doing the test, because 90% of the people on a gluten-free diet still have elevated antibodies. And I'm going to show you. This is somebody who has been eating gluten-free for over 10 years. And this is what's going on their test. They did not do a gluten challenge before testing. So this is a report card to see how well the gluten-free diet is working for them. And then we get to ask why, that important question. We get to deep dive and find out what's going on and why they're still so reactive. Here's another person that has been on a gluten-free diet for a little over 2 years. And I just really want you, one of the takeaways from this is really to read these reports from a nuanced level. Somebody that is on a gluten-free diet should never have any markers in the celiac panel that are this high in the reference range, in my opinion. So I see a lot of these tests, and I would say the vast majority of celiac markers are 0.5 or below. And this is creeping up to about 1/10 of a point from the reference range. And deaminated gliadin peptide IgG is creeping up as well. So why does this person have, why are they headed towards the potential risk of elevated tissue transglutaminase 2 and deaminated gliadin peptide? if they're really on a gluten-free diet. And then these tissue transglutaminase deaminated gliadin fusion peptides, again, most of the time I see those 0.20. They're low end of this normal reference range. So I want to pay attention if they're 0.2 of a point headed in this reference range, especially if somebody reports to eating a gluten-free diet.
Michelle?
Yes.
Can I make a comment?
Please.
On the first test you showed up, a patient been gluten-free, this one, 10 years, how could this occur? How could this possibly occur? Well, every CGP can answer that question because they've all seen the study that we sent to them. I send studies out to all of our CGPs, 2 copies usually, a clear copy to share with your colleagues or to show your patients, and then a highlighted copy of the bullet points, because nobody's got time to read all the studies except for geeks, right? And in March of last year, the American Journal of Gastroenterology, Peter Green, one of the 4 horsemen, gastroenterologist at Columbia, published a study. They took 804 participants, gave them testing equipment, and sent them out into gluten-free restaurants around the country. And they looked at 5,624 items ordered on gluten-free menus. When the waiter or waitress walked away, they opened up their briefcase and put the testing equipment on the table. When the waiter or waitress came back with the food, they immediately took the food and put it in the testing equipment. 32% of everything on a gluten-free menu that was ordered, 5,624 items, 32% of everything was not gluten-free. 54% of gluten-free pizzas were not gluten-free. 51% of gluten-free pasta was not gluten-free. But well, doc, I've been gluten-free for years and I just eat gluten-free pasta, So they think that they're doing it right, but that's why you do follow-up tests, because you find something like this and it takes the patient into a whole deep dive of education with you or with your nutritionist or your registered dietitian or your health coach to see where is the exposure coming from. Because someone like this, there is always exposure going on. Okay, thanks, Michelle.
Yeah, no, thank you so much. And it's communicating with them, right? She mentioned, so I just bought some oat milk, but it doesn't say anywhere on the container that it's gluten-free. Well, if it's not bragging about it on the container, it's not, right? And so it's really encouraging them to be conscious of these things. I see so many people that don't advocate for themselves when they go to restaurants. They look at the menu, they assume that the baked potato is gluten-free, and they don't say to the waiter, I have a severe issue with gluten. I have celiac disease. I have a wheat allergy, a gluten allergy, whatever you need to say to get the point across that this is not a fad, this is not a preference. Would you be so kind as to speak to the chef to make sure that my food is safe? This isn't the waiter's fault, but this is the customer's issue, but we have to advocate for ourselves. We can never just assume, and we have to, if we're eating foods that are labeled, mostly the foods, stay out of that gluten-free aisle, right, Dr. Tom?
Yes.
What you were saying earlier is just, it's not food, it's food-like products that is likely gonna wreak havoc on your health, dysregulate your blood sugar.
Michelle?
Yes.
I've got another example here. Last night, my wife and I went out with some friends to a contemporary restaurant, rated one of the nicest restaurants in San Jose. We currently are in Costa Rica. And it was a nice decor, really, very white tablecloth-ish, and the waitress was very professional, and we could feel comfortable knowing that this was an upscale restaurant. We heard the story. The chef had gone to Dubai and trained in a Michelin-starred restaurant and came back and opened up this restaurant. It has great reputation, great reviews. So we said to the waitress, my wife and I are both gluten-free and dairy-free. He said, okay, not a problem. And thank you, I will let the chef know. And so we felt confident. And so it was a few courses of meals. It was a chef choice. Just bring anything you like. What's chef's favorite? It was fun to explore new things. And this one dish came out. It was like a corn croquette. And immediately I looked at the surface of it. It was deep fried. And I said, that doesn't look like just deep fried corn. And I looked at the waitress. I said, is this gluten-free? Oh, yes, it is. I said, okay, could you ask the chef, Pete, please? Even when the waitress assured us it was gluten-free, please ask the chef, what are the ingredients in the batter that the inside was dipped in to be deep fried like a croquette? And she came back and she said, blah, 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 spelt. I said, spelt? Did you say spelt? And she said, yes. I said, spelt is wheat. Oh, no, sir, it's not wheat. No, spelt is wheat. No, sir, it's not. So I went into my pocket, pulled out my business cards, handed her my business card, and please tell chef I'd like to talk to him. So the chef came out and he didn't know that spelt is not wheat. This is in a highly rated restaurant, one of the best in the city. So you never know when you're being exposed. That's what this person with this test result has to be educated on, is how do you protect yourself? Like Michelle was saying, most people are embarrassed to make a scene in a restaurant. Well, is it better to not make a scene? I mean, my wife is 8 months pregnant. If she'd eaten that thing, she could have gone into early labor. I'm not exaggerating. Read the science. I mean, I was a little hot about this with the chef last night. And I did my usual routine with him, and I will share that with you because we've done it before. Chef, tomorrow I'm posting on my Facebook page and all my social media what happened here tonight. That means tens of thousands or hundreds of thousands of people will see this. And his eyes went like this. And I said, when you institute a training program that you're training all of your staff so you clearly understand what gluten-free means, and you send me the message of what you've done for training, I will then post that, look what this restaurant has done. They made a mistake, like we all can make mistakes, but this is now one of the safest places you could go because now they're trained properly. And it takes that kind of advocacy to create a safe environment, because wheat is the most powerful food trigger in the development of the gateway of autoimmune diseases, leaky gut. Every human develops transient intestinal permeability every time they're exposed. And if you've crossed the line of tolerance to that exposure and it's not transient permeability anymore, that is pathogenic intestinal permeability, now you're on the gateway to you're on the spectrum to develop autoimmune diseases. And it just depends on your genetic vulnerability as to which one it's going to be. And when you start looking at patients like this, now you do the test for the brain zoomers, the neural zoomer plus. You do the test for mold sensitivities, the yeast zoomers. You do the test for ANA. You look for thyroid antibodies, because you're searching now to see where is the weak link in his chain. Because this patient's been doing this for years. They've got elevated antibodies. I can guarantee you this patient, I don't know if we did a test on them, but I would wager this patient has elevated antibodies to self at the time this test was done. Thank you, Michelle.
Yeah, absolutely. Thank you for adding that. So important. So I know that Mary Beth did a great job of explaining why the finger prick and you don't need the total immunoglobulins. One of the things I love about Vibrant is they listen to practitioners, and this panel is so important in my book, and I usually spend at least 5 minutes on it. I like to go through and really discuss what total IgA is, IgG, and help them to understand as we then go into their tests. So we still do blood draws because of this panel, because we feel like it's such an important ad. And I was just with some practitioners last weekend and they didn't know that it was a free add-on. So I just wanted to share, if you're under the Vibrant Wellness tab, it's in the second column, total immunoglobulins. If you check this, it will convert to a blood draw instead of a blood spot. And you can add on total immunoglobulins if that's important to you.
Michelle,
So,
may I
yes,
comment on that one?
yes.
So we have gotten egg on our face many times in the last 5 to 10 years doing these tests and other lab tests where they've come back negative to wheat. And if they eat wheat, they get sick. And at first we couldn't figure out what was going on. And then well, let's check their total immunoglobulins. And they would be low in total immunoglobulins. So you can't use a biomarker of a problem when that biomarker is not working, right? And so if they've got low total immunoglobulins, I have to tell the patient, I'm not sure the accuracy of this test will be what we usually get, because your armed forces, Mrs. Patient, your immune system is the armed forces in your body there to protect you. There's an Army, a Navy, an Air Force, a Marines, a Coast Guard, IGA, IGG, IGE, IGD, IGM. They're there to protect you. But if you don't have an army, you can't check to see if the army is fighting wheat or tomatoes or anything else, because your army is low. So you're not going to get accurate results. And we had that problem. So at first, we were always, once we realized this, we were always adding a total immunoglobulin that we had to go to LabCorp for. So the patient had to get 2 blood draws, and it was a real nuisance, and pay twice, and all of that. And then Vibrant listened, and they said, all right, yeah, that's a valid point. Let's put total immunoglobulins out here. Now that they've developed the technology for the finger prick test, it's really great, but it's a caveat. The caveat is if they are low in total immunoglobulins, it may not be the sensitivity and specificity you're looking for. So if the patient cannot get a blood draw, the finger prick test is a great option. This is my personal opinion and my clinical opinion. The finger prick test is a great option. And during this time of isolation, when people are at home more, they can't get to their doctor's office, doing a finger prick test is a great idea. And I've talked about it many times. But I have to give them the caveat that there's a percentage of the people that don't have total immunoglobulins. And when I asked Michelle, what is the percentage in our practice for all these tests that we're running, how many people have a deficiency in total immunoglobulins? Michelle, what was the answer?
About 3 out of every 4 tests I look at, there's some level of compromise in the total immunoglobulin panel.
Do you hear that, clinicians? I mean, that's how common it is. And so I'm on this summit, I'm challenging Vibrant Wellness, and I know the guys in the back room, and I know that they're working on this, but to keep working on the technology so we can do total immunoglobulins in a finger prick, because it's such a valuable service to be able to do the finger prick. But if they have low total immunoglobulins, then you're not going to be able to stand on the sensitivity and specificity. That's my clinical opinion. Okay.
Yeah, no, thank you. And here's an example. We don't often see them this low. This is pretty significantly, I mean, this is a really ridiculously wide reference range. Some of these reference ranges just keep getting wider and wider, and you wonder at what point when it was initially created, what the ideal really was then. But this is a really low, some people might want to refer out for this. I think the big question is why? What's going on here? And I'm not finding that the things that we thought were, basic changes like colostrum or total immunoglobulin or, serum derived immunoglobulins and healing the gut, we may retest in 6 months and I'm not getting the changes that I want to see on this panel. I believe personally, there's a huge stress component. And think right now, is there one person that's coming into your office or that you're working with via Zoom that isn't dramatically impacted by 2020, right? There's so much emotional stress going on right now, and there's a lot of physical stress. There's toxicity. So I really think that's playing a role. Like Mary Beth said earlier, nutrient deficiencies. definitely play a role. Vitamin A, C, D, E, Bs, folic acid, beta carotene, iron, selenium, zinc. If your patient is low in these, you might want to run the micronutrient panel or just really address supporting that. And we need amino acids to make immunoglobulins. And so many people are not breaking down their protein. They may not be eating enough, but they may not actually be digesting it and breaking it down into utilizable amino acids. So those are just some things that I wanted to bring up. As any of you practitioners figure this out, please let me know, because I have a deep passion for helping people to bring their immune system back into balance. And I just think this panel is so key. This particular client with her elevated total IgE, which can often be associated with histamine response, mast cell, but it can be associated with parasites. And she had on a stool test on the gut tumor, she had parasites show up. So I felt like that was significant to add. Okay, let's keep going here. Oops, skipping. Here's the old panel. So they always had IgG and IgA, or actually I think they just had total IgA at the beginning. That was part of the celiac panel. But here's an example of another person that had really low total IgG and IgA. And is it 50% of people on the celiac spectrum, Dr. Tom, that have low total IgA?
Somewhere between, I'm not sure if it was as low as 30, but 30 to 50%. It was either 30, 38 to 50. Yes, in that ballpark.
Okay. And there's some great things online that I often share links to with the clients that I'm working with to help them understand these immunoglobulins if they want to do more research online at home to see what could be contributing to that. Here's another example. I'm just showing the IgG is definitely low end of normal. I like to see people at least in the upper 2/3 of the normal reference range on IgG. So that's about 1041 or higher.
May I comment on that one?
Yes.
We want our patients' immune systems to be robust.
Mm-hmm.
You know, the reference ranges are determined by, well, if you're not sick, it's probably okay. So I guess we can go up to here, you know, and as Michelle's saying, they're expanding, expanding, expanding. But we want their immune systems to be robust within the reference range, not barely holding on, not kind of in the middle. If we can, we want to bring them up, strengthen them. Critically important concept. And when I see elevated IgM, it's a huge, huge warning to me, because IgM is the earliest antibody. It's a component of polyreactive antibodies, circulating polyreactive antibodies in IgM. About 1/3 of the circulating innate immune system is IgM antibodies. And when I started reading that science, wait a minute, antibodies are the adaptive immune system. Yes, but when you read Lewis Notkins out of UCLA, one of the godfathers in immunology, he talks about IgM as being a component of IgM as polyreactive antibodies are circulating as a first line of response to help the innate immune system. They're circulating in and they're polyreactive. They can attach onto many different substances, not just one thing. So this person, if with the low IgM, their immune system's already compromised to where they're an open book and say, okay, I'm here, whoever wants to take over in my body, come on in, because they've lost part of their innate protective immune system. The other aspect of this that I really don't like at all when I see a low IgM or a high IgM, last time I counted, there was a check. Last time I checked, I didn't count it. Last time I checked, and that was about 8 months ago or so, there were 264 studies on IgM elevated antibodies to herpes simplex 1 and Alzheimer's. 246 studies. So when you have elevated IgM, And that's why herpes simplex 1 is part of the Neurozoomer Plus panel. Is you have elevated antibodies, that's a problem. And when they do autopsy on people who died with Alzheimer's, the beta amyloid plaque is loaded with IgM antibodies to herpes simplex 1 and many other things, bacteria like Klebsiella, Pseudomonas. Those antibodies are inside the plaque, the beta amyloid plaque also, but herpes simplex 1 is a primary. So any of your patients that get cold sores, repeated cold sores, do the Neurozoomer Plus on them to find out how much inflammation is going on in their body right now. Okay.
Right, and that marker is so important, it's even on the Neurozoomer. And it impacts, I looked online, just Googled how many people have elevated antibodies to herpes simplex 1, and it's about 90% of the population, so it's pretty significant. And if IgM is the first responder, why is it being called out all the time and getting used up? You know, there's so many questions, so many why questions to ask with that. Here's another: low, normal, lab low, low normal. So this is just what we see all the time. This is low normal, and elevated IgE. So now we get to start sleuthing out what's going on, what's causing their IgE to be elevated. And then we went over that already. So now let's dive into the intestinal permeability panel. So I think it's, this panel is so great. And I like to share with clients that I'm working with kind of like clinical severity of intestinal permeability. So this is the most concerning when they have LPS antibodies, as well as actin, and especially IgA antibodies positive. And then next would be IgG and IgM. So we rarely see normal intestinal permeability, but usually somewhere they're on the spectrum. And this is when they're getting towards this end, we really have to prioritize this. This is critically important. So I like to show pictures because I just think that just showing a that panel, people are like, you know, intestinal permeability, leaky gut, we hear those words thrown out, but when they can actually see what pathogenic intestinal permeability is between the cells in the gut and through the cells in the gut, and arguably these tight junctions are designed to possibly open and allow individual nutrients out or amino acids, but there should never be tears through the cells. They're not designed to open. So just for having people be able to see these, here's another one that does a better job of showing LPS and how LPS can contribute to intestinal permeability and then create this whole inflammatory cascade in the body. I just find that once people are able to see this, they get it. So don't be afraid to find pictures, print them out, or if you're doing Zoom calls, share screen and show people so that they really understand the mechanisms of intestinal permeability.
Michelle,
Mm-hmm.
may I make a couple comments? I've just pulled up a couple of other slides I want to show you. Now, but before we do that, let me just say, as you're looking at this slide here, remember what I showed you about the composition of the blood-brain barrier. And if you test this patient, this drawing here, when patients have this kind of a thing going on, you're going to find antibodies to actin, to myosin, to claudin, to zonulins. That's the biomarkers of leaky gut, which are also the markers of the blood-brain barrier. Now, I'm going to share screen for a moment, if I may, because I cannot share screen while the other participants, okay? So Michelle has stopped that for the moment, so I can bring what I want to show you up here. And let's put this into, you can see I've got a bunch of things open here, but let's bring this to, this just came out this year. And early onset dementia and Alzheimer's rates grow for young Americans. Look at these numbers. In 4 years, there's been a 200% increase in early onset dementia and Alzheimer's between the ages of 30 to 64. In 4 years. And When you break it down by decades, look at these numbers. These are your patients. This is why the NeuroZoomer Plus, that's why every patient that I recommend test to, we start with the Wheat Zoomer and the NeuroZoomer Plus. And there's bundles, they're great. We use a lot of the bundles, but when I'm wanting to do the deep dive and say, what's going on for this person? And when you do a NeuroZoomer or a NeuroZoomer Plus, and they've got the elevated antibodies and you talk to them about that, they're on board. They're on board because everybody knows someone that had a heart attack and survived, changed their diet, started exercising, they look better than they've looked in years. Most of us know someone diagnosed with cancer that went through the recommended protocols, put in remission, and they feel good. No one knows anyone diagnosed with a brain deterioration disease that's doing good. The sooner you can identify this stuff, the sooner the likelihood that you can slow down the progression of what's going on. And this is not the time to talk about where's all these triggers that are causing this, but it's the 5 pillars that Fasano talks about: environmental triggers, microbiome, intestinal permeability, and the most potent environmental trigger is gluten and small intestine bacteria, LPS. Okay, thanks, Michelle.
Yeah, no, that's super sobering.
Yeah.
Very concerning. And I have so many people that say to me, I'm terrified to do NeuroZoomer Plus. I don't want to know. And I'm like, and I learned this from you, that is the wrong way to think about this. This test is profound because it takes decades of damage, of killing off brain cells, before we develop symptoms and then get a diagnosis. So you want to run that and be like, this is the time that I can reverse this and turn this around and do a Wheat Zoomer with it. You want to keep doing that Wheat Zoomer till you get it clean, because I see as people clean up their Wheat Zoomer, they clean up their NeuroZoomer Plus, which is really profound.
Absolutely.
Okay, so intestinal permeability is always caused by something else. So it's not the root cause. And the 2 main things that Dr. Fasano talks about, gluten, like you said, Dr. Tom, it causes intestinal permeability in every human, and LPS are included on this test. But just know you have job security, because look at all of the other mechanisms of pathogenic intestinal permeability. So this is critical. Wheat Zoomer is critical because you want to find out if it's caused by gluten, if LPS is one of the triggers. But stress, I put stress here because stress is so huge with everyone that's coming into our clinics. So I often have to say to people, if stress is 90% of the reason that you're here, then that's where we have to put 90% of our effort, right? Because we can't out supplement that cortisol response if people are just in this constant state of fight or flight. So this is important. Diet. I mean, people are abusing alcohol like crazy because of all the stress of 2020. And they think that they're using it for self-soothing. That lectin zoomer is so important. Food sensitivities, processed food, excess sugar, fast food. That food additives panel I love, because it really helps people realize that they need to be eating whole, real, nutrient-dense, organic food that's not processed, that doesn't come from a can or a bag or a box. Chemical toxicity, I just put 2 down, but there's so many more. Blood sugar dysregulation, insulin surges, hyperglycemia is likely impacting on everyone that you see. So that's really important to address. And sometimes we have to start there before we can really start to unravel the whole intestinal permeability. So there's carrying extra weight, but there's also this chronic issue with over-exercising. I had somebody have an elevated zonulin that was so significantly out of range after they did a they had exercise bulimia, but a really significant workout that morning. So we try to get people to fast before the wheat zoomer for that one marker, that whole blood zonulin, to just kind of get a baseline. It has a half-life of about 4 minutes to 4 hours. And so don't go out and exercise. Don't eat a piece of gluten-containing toast so that it's artificially elevated. Let's just see what your baseline is. Hormonal, neurological, so we just talked about that, neurodegeneration, medications, infections. This is impacting on so many of the people you're working with, some form of infection. Toxic metals. Please do not try to chelate somebody without doing a neural zoomer plus and identifying blood-brain barrier permeability. That's a recipe for disaster if they have blood-brain barrier permeability and a leaky brain, and you're trying to chelate. And then just a couple of the nutrient deficiencies that we had time for. So I just think that neural zoomer plus, like Dr. Tom says, is so critically important. If they have intestinal permeability, leaky gut, then you've got to rule out the connection with blood-brain barrier permeability is so strong that it's really important to do a neural zoomer plus. I think that's such an important investment. Determine what's causing the permeability, identify if autoimmunity has developed, and I still am holding out that Vibrant's going to come out with a autoimmune screen. So they do have an amazing panel on the Neural Zoomer Plus for autoimmunity, brain autoimmunity. So see if there's, you know, a lot going on there that's brewing for somebody. You can run thyroid antibodies. It's shocking how many people have either the early stages or full-blown thyroid autoimmunity. And there's other markers through Vibrant America that you can add on specifically to start identifying autoimmune. So I like to show about pictures too. This is more of the baseline picture to just show them how similar the gut and the blood-brain barrier are. I think it's important for them to understand that concept. So this I hear so often from practitioners: don't be this practitioner. Don't say, we don't need to waste money on that test. Everybody has intestinal permeability. Look at this intestinal permeability panel. Look at this person's zonulin, IgG. It's 27-fold out of range, 27-fold. What if this person would have committed to all of the lifestyle changes that you gave them for healing their gut, and they faithfully took all the supplements, and then they just decided 6 months down the road, you know what, I kind of do want to test because I want to see if all this hard work is paid off. Let's say that this anti-zonulin was now down to 15. They could look at you and freak out and say, nothing I did worked. Look at how it's worse. It's not worse. It dropped in half. We should be celebrating that. And we just know that we have to stay the course. So get those baseline biomarkers as soon as you can. I get passionate about it. Yes, Dr. Tom.
Can you put that slide on full screen?
Is it not showing full screen?
Correct.
Sharing your desktop right now and not the
oh my goodness. Oh, what an amateur move.
We were going to text you, but you had your text thing open and I didn't want to be
right. So, great, thank you. And
oh my gosh, just pipe in next time, Michelle. Amateur hours. Stop sharing your whole screen.
It's all good. It's good. But let me make a comment also here.
Yes.
That test, don't guess. That we have to know where we're starting from exactly for the reason that Michelle said. If we waited 6 months down the road with protocols and the patient's doing much better, but there's still some or a new symptom that may be indicative of leaky gut, and you say, well, let's do that test and see, and it came back at 15, you'd think, the patient would think that everything they've done is not working because it's supposed to be below 0.89 and it's at 15. Whereas in reality, you've cleared it up by half. You've reduced it by 50% if it started at 30. And you say, no, we're on the right track. Now let's tweak it a little bit, but keep doing what you're doing. It's really working. And you'll lose 6 months, a year of protocol. because you won't have the markers to start with. That is why you always want to, it depends on what kind of clinician you want to be, excuse me, but what kind of clinician do you want to be? Do you want to be a clinician that's dealing with their aches and pains and the symptoms that brought them in and bringing relief to them? Or do you want to bring them relief and get to the underlying mechanisms of the disease that's developing down the road, right? If you want to be more comprehensive, which is why you're here, I'm sure that's the case. If you're looking at these specialty tests, you're in the world of complementary, integrative, functional medicine, wanting to find the cause. And usually there are many the causes for a patient. There's not one, right? But we need the markers to know where we're starting to document the improvement. Well, my patient won't pay for it. Now, I'm going to tell you what I do, and I did this in my practice for years and years. When they say that insurance won't pay for it, so they're not going to do the test, then I write in their file, and this is when before keyboards, I started this before keyboards, patient refuses to do blood tests because insurance won't pay for it. Would you please sign this? Well, why? Why would I sign this? Well, because I'm going to do everything I can to help you, but you're making me have one hand behind my back. So I'm not going to be responsible if something serious happens to you and your family hires a lawyer and they go back and see that no one ever did that test for you. So, I'm still going to give you my best care, but with one hand behind my back. Oh, no, that's okay. All right, I'll do the test. Okay, good. Thank you. Let's do it. Because so many times I've had the experience, and many of you have, patient says, well, if insurance won't pay for it, I'm not going to do it. And you see them 3 months later, they've got a nice tan. Say, oh, you got a nice tan. Yeah, we were in Cancun for 2 weeks. So they'd rather pay for a trip to Cancun than to pay to identify the mechanisms that's causing their numbness and tingling, which if you would identify was the precursors, and they're on the spectrum to developing MS. But they'd rather go to Cancun because they don't understand the priority. So when I realized that I was not to be their friend, I'll tell you, I had a wonderful, wonderful staff person who did foot reflexology treatments in our office. And she also did colonics at home for people. She was the best I've ever experienced. And really wonderful German woman. Yeah, we take care of you. Yeah. Just one of those kind of husky Helda type of women. And her husband was a small, short, thin guy, wonderful beaming spirit. He was the custodian in a local grade school. And a bunch of the kids would always say things, hi, Ray, how are you, every day, because he was one of those happy kind of people. And he'd come in every once in a while and I'd say, Ray, let's do a blood test to check for cardiovascular risk, because he had creases in his ears. And he said, no, my doctor says I'm okay. Well, did he do a blood test? Yeah. Can you have him send? Yeah, okay, doc, I'll sign this. And then my staff would ask to send the test over. Cholesterol, HDL, and LDL. The cholesterol was 215, something like that. The ratio was a 2.6 to 1 cholesterol to HDL ratio, 2.6 to 1. Not great, should be above 3 to 1. So I'd say, Ray, let's do a more comprehensive blood test. And it would have been lipid subfractionation, looking at the types of LDLs, the types of HDLs, homocysteines, HSCRP, fibrinogen, you know the routine. And he said, oh, I don't know, doc, I don't know, it's a lot of money. I say, oh, okay, well, Ray, I know, but it'd be really good to do the test. And he wouldn't do the test. And a couple of years down the road, he comes in one day, he says, doc, let's do that test. So really? He said, yeah. So I drew his blood immediately. And okay, Ray, we'll have the results in 4 or 5 days. Ray died on the way home of a massive coronary. He probably came in, say, let's do that test, because he was having chest pain, but he didn't want to say. And I asked him about his symptoms, how he was feeling and all that. He died on the way home. That was the last time I accepted, no, I don't want to pay for the test, without calling him on it. And so every patient, they want to do the test, they're going to sign and take responsibility for it. I'm still going to do the best I can for them, but recognizing that they've refused to allow me the information that I think is going to change the direction of their health. So for you, you may have stories like that and haven't thought about what to do about it. You have them sign the document that they refuse the test, because these tests change lives every single day. They're identifying the underlying mechanisms. Fasano tells us the 5 pillars in the development of chronic inflammatory diseases. And at the two ends, you really can't do much about that, but the ones in the middle, environmental triggers, microbiome, and intestinal permeability, we've got complete control over. That's why these tests are so powerful. Okay, Michelle, thank you.
Absolutely, Dr. Tom. We're both really passionate about this because we see it on a daily basis. It's just such valuable money spent. Like, people are investing in themselves, their health, and what better investment is there? And I often get the question too, like, well, what's your leaky gut protocol? So job security is that we don't have just one leaky gut protocol, that we're like looking at this and saying, okay, well, the good news is for this person is LPS doesn't seem to be at play here.
Right.
So that's good. So now how do we address this? But it's really personalized to each person. You may have some key things that you use, but I'm a big fan of praying. I'm not a fan of pilling and praying. And I think that's what happens a lot of times when people don't run this test and they assume everybody has intestinal permeability. They're just throwing supplements, praying that they work. And
I can't tell you how often when I'm at a seminar or a symposium, someone comes up to me and says, doc, I give glutamine for intestinal permeability. And I go, okay, that's great. Glutamine's really helpful, but it doesn't turn the genes on to heal the gut that curcumin does, or that vitamin D does. Glutamine does not control the gates of the tight junction. Vitamin D does. That's why a pleiotropic approach, meaning all roads lead to Rome, is so important, because you're turning on genes to reduce inflammation, turning on genes to heal intestinal permeability, turning on genes to reduce pathogenic bacteria, encourage the development of probiotic bacteria. There are so many components. There is no package protocol that works. We have a package protocol to rebuild a healthy microbiome that we recommend as a strong component for all of our CGPs to use, but we don't have a package protocol to heal leaky gut.
Yeah, important supplements though that are in the research, absolutely.
I'm sorry, one more thing I'd say about this test result that we see here. Clearly, there is an active process going on for this person because their zonulin levels are so high. Clearly, it's active. It's going on right now. So what does that mean? Well, maybe it's dysbiosis. Maybe they've got small intestinal bacterial overgrowth. Maybe they are just dysbiotic. Maybe they've got pathogenic bacteria. Maybe there's a blastocystis infection, a Klebsiella infection. But I'm going to look at the microbiome here. I'm not going to try and heal leaky gut until I find out why this is going on. We're going to try and change the diet as quickly as we can, assuming, Mrs. Patient, the most inflammatory trigger pouring gasoline on the fire, causing inflammation in your body, is what's on the end of your fork. We know that, and so we're going to test. That's where the Zoomer bundles come in and why they're the best on the market, right? But I need to know, why is this zonulin level so high? Because the shelf life of zonulin, the half-life, is 4 minutes to 4 hours. Why is this so high? What is it that's happening right now for this person? So that's one component of differentiating treatment protocols from leaky gut results that are high zonulin, or leaky gut results that are high zonulin antibodies and actin antibodies, right?
Yes, thank you. So here is another example. This is somebody who has on the low end of normal for total IgM. So you're thinking nuanced right now, right? You're always thinking of this total immunoglobulin and where this person stands. Now, their IgG, total IgG is pretty good. It's at the bottom of the middle third of that reference range. But look at how high they're creeping up to this control range for the combination of IgG and IgM combined. So someday Vibrant's going to have these separated, but for right now they're combined, and we're just grateful that we have IgA, IgG, and IgM. But you've got to be looking at it in that way, because we don't want to wait till this is out of range to figure out where this LPS is coming from. So gut zoomer, absolutely. They have to do a stool test at this point, but start asking questions about their dental health. Do they have root canals? Do they have bleeding when they floss? When was the last time they had a dental exam? When the dentist or the hygienist did the periodontal probing, the 2, 3, 4 around the gum line, were there any concerns? Do they have chronic sinus infections? Do they have chronic UTIs? So you've got to be figuring out where this is manifesting in the body, asking questions, asking why. So this person is more towards this endotoxemia, and they're headed in this direction for sure. So Dr. Tom talked about this, so I'll kind of zip through this, but those hidden sources, what contributes to this happening when somebody is on a gluten-free diet. So hidden sources of gluten, really talking to them about, if they're not in a gluten-free household, then they can't be sharing a toaster oven and a cutting board with other people. If somebody is using the same jar of peanut butter and scooping in with that knife and spreading it on gluten-containing toast and then scooping another scoop out, they've contaminated that peanut butter. So they have to have their own jars so that there's not, this is where we get to teach them, right? Where to find out where they're getting exposures.
Michelle?
Yes.
Let's stay with that for a moment, because that's a really good point. And for people to dial that one in, ask an immunologist. The mechanism by which vaccinations work is that they give you a shot of the bug, measles, or yellow fever. If you go into Africa, dengue fever, yellow fever, and you get these vaccinations months and months ahead of time. Mrs. Patient, what happens when you get a vaccination is that your brain says, whoa, what's this? You general, and in your immune system, you've got Army, Air Force, Marine Corps generals sitting around with nothing to do. General, you are now General Yellow Fever. Take care of this. General Yellow Fever builds an assembly line. Takes weeks. The assembly line starts producing soldiers. They're called antibodies. These guys are special forces. They've got high-powered rifles, and they're going through the bloodstream. They've been trained to just go after yellow fever. Now think about your bloodstream. It's just a highway. There's no lanes of traffic with organized flow. It's just a highway, and everybody's bumper cars in there bumping into each other, right? So how do special forces fire their chemical bullets going after yellow fever and hit it? They're trained to look for yellow vests. Yellow fever has a yellow vest. It's called an amino acid signature. So there's an amino acid sequence that the antibodies are trained to go after. I'll say it's AABCD. Sometimes it's 30 amino acids long, sometimes 8, 10, but it's that yellow vest that special forces are going after in the bloodstream. When General Yellow Fever, who built the assembly line, sees there's no more yellow fever bugs in the bloodstream, he turns off the assembly line. So they're not making any more antibodies. So the antibodies that have just been made when the assembly line was turned off, they have a lifespan 4 to 6 weeks usually, something like that. And then they're out. You shouldn't have yellow fever antibodies in your bloodstream right now. So that whole process takes months, maybe 3, 4 months to prime you. But now General Yellow Fever is vigilant the rest of his life. If yellow fever ever comes back in again, General Yellow Fever just has to flip the switch. He doesn't have to build the assembly line. And in 2 days, special forces for yellow fever are back out in the bloodstream. That's called a booster shot. And if you go back to Africa 15 years later, you just need a booster shot 2 weeks before you go. General Yellow Fever is called a memory B cell. when you have elevated antibodies to wheat, you produce memory B cells to wheat. I've not found any literature on memory B cells to eggs or to dairy or tomatoes or anything else, but there are studies about memory B cells to wheat. So that mechanism is going on. Now, when those soldiers to wheat, now I'm going over to wheat, when those antibodies, the soldiers to wheat, are in the bloodstream, they're looking for the yellow vest, AABCD. They're looking for that yellow vest. And the blood goes everywhere, right? So the blood's going past the thyroid, and the surface of the thyroid facing the bloodstream is made up of proteins and fats. The proteins are made up of amino acids, hundreds of amino acids long, which may include AABCD. We call that molecular mimicry because the special forces now fire their cytokine, their bullets at the thyroid, and you damage the thyroid cell. Now, the immune system that has a normal level of antibodies to thyroid, because that's how you replace old and damaged cells, has a normal level, but now there's extra damaged thyroid cells. So you have to make more thyroid antibodies. Not a problem, except you have wheat for breakfast, lunch, dinner, a cookie, croutons on your salad, a little flour in the gravy, you know, day after week, after month, after year, boom, boom, boom. And if your genetic vulnerability is to thyroid disease, then the soldiers, the antibodies to wheat, go after your thyroid, and you make more antibodies to thyroid, and after a while, that mechanism becomes self-perpetuating. Now you develop Hashimoto's. And that's the molecular mimicry mechanism of a wheat-related disorder. Now, General Gluten is vigilant the rest of his life, as far as we know. So you're squeaky clean gluten-free, and you retest 6 months later, and the antibodies have all come down to normal range. Great, doc, can I eat wheat now? Well, probably not, but because you've got general gluten now in your bloodstream. Never seen it for eggs or anything else, but in the science, but I've seen it for wheat. But if you want to know, go ahead and eat some wheat, you know, for a couple of weeks, and then let's wait 2 more weeks. Then we'll do the test again, and if the antibodies come back, then you know this is permanent. That's the only way you can do this, so that the patient is convinced. And if they don't know, I feel great, doc. I feel like $1 million. I'm going to stay with this the way I am. That's the molecular mimicry mechanism in layman's language. Feel free to use it in any way you like. And sorry for that interruption, Michelle. I know you were about to go into cross-reactivity. But...
No, that's great. I think it's an important analogy to use with patients and clients so they get it. I appreciate all of your analogies. So yeah, with this person, I mean, automatically you're wanting a dairy zoomer, you're wanting a corn zoomer to see if they have that corn wheat overlap epitope, if that's what's driving this, and you want a grain zoomer to see if, you know, they need to be on a grain-free diet in order to get this all calmed down. And sometimes we see that once the LPS antibodies come down into range, this will resolve as well. So there's different mechanisms there that are going on you want to think about. Now, for these markers, gluteomorphin, prodynorphin, they're so critically important to know that this is now really impacting on the brain. When I see these elevated, I frequently will see tissue transglutaminase 6 elevated. So we know that their brain is under attack. And this is an excellent article. You can screenshot this that I share with anyone with elevated gluteomorphin, prodynorphin antibodies. It's called Bread and Other Edible Agents of Mental Disease. So it's a little bit of an unnerving panel, but it's an easy read, even for a layperson. We present the implications for the psychological sciences of the findings that in all of us, bread makes the gut more permeable and can thus encourage the migration of food particles to sites where they are not expected, prompting the immune system to attack both these particles and brain relevant substances that resemble them, and releases opioid-like chemicals capable of causing mental derangement. Now that's like a little, but there's many stages before somebody gets to that point. And I think that the people that we're working with, they're kind of terrified of the brain stuff. I think almost everybody is, if they make it to the brain. A grain-free diet, although difficult to maintain, especially for those that need it the most, can improve the mental health of many and be a complete cure for others. How often in research do you see things like a complete cure? So that's a pretty impressive article. So when you're ordering a Zoomer bundle, I really encourage you to add on celiac genetics. I'm not going to say prices here, but when you're done with all of this Zoomer and you're ordering this panel for yourself with the discount, because everybody wants to find out at the end of this, it's so important. Do this test on yourself. This is so inexpensive when it's an add-on. So unless you've already, determined whether or not you carry DQ2 or DQ8, I think that's a really important add, and especially for that price point. And then there's 11 Zoomers, and I'll get more into it's. Again, there's just not like a set 4 that I run on everyone if they can only afford 4. But it's really important that first consultation, as you do a deep dive on their health history, which ones does this person need? And then again, adding on that total immunoglobulin. And then there's one add-on that you get to choose as well. And we'll talk a little bit more about our thought process in choosing that add-on. So let's come here. These are the ones that I most frequently recommend. I really love it if somebody could at least order 7. But again, if that person has told me, like we've sleuthed out and we're talking about blood sugar dysregulation, and they say, yeah, I often am hangry, but I have a jar of peanut butter in the fridge and I just go get a spoonful of peanut butter, I'm going to want to add on the peanut Zoomer for them, right? So it's really in talking to them and determining what their needs are that you determine which Zoomers are most important to add. Anyone on the autoimmune spectrum, I feel like lectin Zoomer is key. If somebody has elevated wheat germ agglutinin on the wheat Zoomer, then the lectin Zoomer is a key add. So when there's elevated wheat germ agglutinin, which for those of you that are running this test, it's rare to not see something elevated in that panel. You want to think vitamin D. You want to run a vitamin D test to check their vitamin D levels. You want to think, does this person have a healthy enough mucosal lining? And do they have lectin Zoomers? A lectin sensitivity. Corn Zoomer, I just find that so many people that find out that there's a gluten or wheat sensitivity, they start powering down the corn. Now, if I can get somebody to commit to not eating corn, I still really want that corn wheat overlap epitope, though, because I feel like that's so important for them to know that their body thinks of corn like it's getting exposed to wheat or gluten, especially if they have a significant wheat Zoomer test. Dairy Zoomer, dairy is just so inflammatory to the body. So, and there's so much more valuable information on the dairy Zoomer. So many people that I work with, they're like, I don't eat dairy. And then I find out that they're powering down cubes of butter, and they don't make the connection that butter is dairy. But when you're able to explain to them that there's likely a sensitivity specifically to the fat in butter and ghee, and that they may need to take a break from that. That is just such an important panel. Egg Zoomer, sadly, there's so many egg sensitivities, and I wish that wasn't the case, because eggs look the ultimate fast food, right? Hard boil some eggs and throw them in a little Ziploc bag. Take them, put some salt in, take them on the airplane, right? And they're rated 100 on all proteins. Everything else is rated below an egg, but this is really important for anyone autoimmune and just skin issue. There's so many things. I just think that's really important to rule out. Soy Zoomer is another one that can be really valuable. We want to go for the lowest hanging fruit. Like I've yet to have anyone come back to me and say, Michelle, I eliminated the zucchini and I'm well. Like clearly zucchini was what pushed me over the edge, right? But people say, I eliminated the soy, I eliminated egg, I eliminated grains, and all of these improvements happened in my life. So be thinking about that with those. If somebody has elevated wheat germ agglutinin antibodies, then maybe you want to go for, if they can only afford 4 Zoomers, go for all of the higher lectin foods. If somebody's vegan, then you definitely want soy, and this is a whole food vegan diet. I still think lectin is so critically important to put in there, but this person maybe is having nuts multiple times a day. So just really, this takes your clinical experience, it's job security, helping your patients to figure out which tests are most important for them. Mammalian milk, I have people that will say to me, Michelle, I don't do cow dairy, I just do goat and sheep. I still really want the components that are found on this cow dairy, and I often see it out of range. And then if somebody has things out of range on wheat Zoomer, I really want them to commit. The research says that if you have a gluten sensitivity, you should really eliminate dairy for a minimum of 6 months. So I really want them to give up all dairy if they need to, but then maybe in 6 months' time on their repeat test, they could add on mammalian milk Zoomer to see if they can possibly add goat milk back in, or camel's milk. So here is one of the reasons why I think this test is so important to add on if somebody's on the autoimmune spectrum. I was hoping we'd get to have Dr. Gundry do a deep dive on this, but if I see any legumes show up, and I really want them to cook any of the legumes that aren't a problem in a pressure cooker, so an Instant Pot on that pressure cooker setting, just to make them more digestible.
Let's comment here on
Yes.
on the aquaporin. That for those that don't know, aquaporin is a component of our nerve tissue, and it has very strong similarity with corn, soy, spinach, and tomato. And tobacco and bell pepper. I wasn't familiar with the tobacco and bell peppers. I knew of the other 4: corn, soy, spinach, and tomato. And aquaporin 4 is a fairly common allergen to see that antibody elevation is positive to. So in those people, you certainly want to check. That's why it's so great that on the lectin Zoomer, not only are they checking aquaporin, but they're also checking the foods that may have molecular mimicry with aquaporin. Because it easily could be you have a corn problem, which comes out on the corn Zoomer, or on the lectin Zoomer, it says corn in general, and it's manifesting via molecular mimicry to your nervous system, and often affects the eyes and the vision. Ophthalmic conditions are often associated with elevated aquaporin antibodies. So it's great that they're included here in the lectin Zoomer.
Absolutely. And there's markers that test for that on the Neural Zoomer Plus that recommend you got to do a lectin Zoomer if there's elevated antibodies to that. So yeah, and the aquaporin is an integral part of the protein. You can't reduce the aquaporin content of food. You can reduce lectin. Now, if something is out of range, I think it's really critically important that they avoid it, especially if it's an IgA, because likely, since IgA antibodies are made in the mucosal lining of the gut, it's often causing or associated with their gut inflammation. But you can reduce the lectin content of many of these foods. You can peel a cucumber and take out the seeds, and you've really reduced or eliminated most of the lectins. But I think it's important for a period of time, especially depending, you're always going back to that wheat Zoomer, that intestinal permeability panel, to see how committed this person needs to be. If they're sensitive to so many, let's say they did the full food sensitivity panel, and now they're sensitive to 100 foods, right? How soon before you put them on the other 100 foods that they can't eat, or 40 foods that they can't eat, before they become sensitive to those? So sometimes you just did an expensive test to put them on a food rotation diet. But Yeah, it just all depends. So I like to wait on those food sensitivity tests until I've determined the level of intestinal permeability. That's why I'll often do food additives, neural zoomer, um, just the basic free add-on neural zoomer if I really want to like just get this person to see that this is likely impacting on their brain. And then IBS sure if somebody is experiencing SIBO or SIBO type symptoms, that's a really great test.
Michelle?
Yes.
There are a few questions in the Q&A that I'd like to address.
Let's jump in and get them.
Yeah, and then I'll have to bow out. So the first one from Vincent, how do we avoid negatively impacting the microbiome if we remove gluten completely, given the fact that we removed 80% of the prebiotics from gluten-free diet? Thank you. Really good answer, or really good question, really good question. Critically important concept to address, critically important. And you supply the prebiotics. We have our patients eat root vegetables every day. I have them go to Google and type in list of prebiotic foods, print it out, put it on their refrigerator. When they notice that a banana is a prebiotic, that an onion's a prebiotic, they understand 1 root vegetable every day and 2 from the list every day. And you're training them, but we also will supplement them for a couple of months. We use Mega Prebiotic or another type of product for that, but Mrs. Patient, for 2 months, while you're transitioning your eating style, I want you to take this prebiotic to make sure we don't cause any type of a deficit, but train yourself, for you and your family, to select foods that are high in prebiotics, and you'll get educated by following the list and trying the different foods. Next one, what device did people use at the restaurants to test for presence of gluten? That was the NEMA, N-E-M-A, the NEMA device. And I looked at the science on it. It's over 97% sensitive and specific. It was impressive. I was really impressed with the science when I didn't know anything about NEMA until then.
But is it only testing alpha gliadin, the 33 amino acid chain?
That's exactly right. And that's the problem with all of the testing out there for gluten and wheat in a food. They're only looking at one peptide of wheat, alpha gliadin. Well, what about amylase trypsin inhibitors? Well, we don't check for that. What about the gluteomorphin? Well, we don't check for that. But wait a minute. I see in my testing, because I'm using sophisticated testing now, the wheat zoomer, that my patients may react to different peptides of wheat. And to be labeled gluten-free, it just has to be free of alpha gliadin. Are there some products that are not free of wheat, but are free of alpha gliadin? Yes. Do I know which ones? No, but there are some like that. That's why people eat gluten-free products, and it can still be a catalytic trigger to their immune response. What do you say to patients, doctors who are skeptical about IgG antibody testing because they're just reflective of exposure or IgG is healthy? That's really great. So I'm going to share a screen here for a minute because I'll just show you a couple of slides on that one, if I may. Let's see, there we go. So let's bring this one up and then let's bring it to full screen here. And let's put the questions down out of the way. So IgG4 is an intriguing antibody with unique biological properties. And why do they say that? Because it plays the protective role in allergy by acting as a blocking antibody, inhibiting mast cell degranulation. But it also can be a deleterious role in malignant melanomas by inhibiting IgG1 mediated anti-tumor immunity. I talked about that at an international cancer conference 3 years ago in Abu Dhabi, and all the oncologists just went, what? They had no idea how food sensitivities, keep eating a food that doesn't make you sick, but if you're increasing IgG4 levels with that, it inhibits their anti-tumor protocols that they're doing. So there's nothing wrong with having IgG antibodies, but when you have elevated IgG antibodies, the question is, why are they elevated? What's going on here? And so when docs say, well, it's just a record that you've been exposed. Okay, I'll accept that if you're within a reference range. But if you're elevated, it means your immune system is fighting this thing. By definition, it's elevated. So I don't pay much attention to IgG antibodies if they're within a reference range. I mean, why would we? But the value of this testing is that you're looking at elevated levels of those antibodies. That's what you're identifying. And then you're deciding what type of protocols you want to deliver. So that is just a little discussion about the IgGs, which I think is really important because it's such a confusing concept for clinicians. What is your view about the safety of organic ghee if someone's positive for dairy? Really good question. If patients do not have elevated antibodies to milk butyrophilins, they can have ghee because ghee is just the fat of the milk molecule. But the fat molecules, the surface of the fat molecules have a protein called milk butyrophilins. And so if you've got elevated antibodies to milk butyrophilins, you can't have ghee. If you don't, ghee is okay, as far as I know. Overactive bladder, would lectin-zoomer be a priority test for nerves? That's a really good question. The answer is it might be. For me, any organ dysfunction, I'm going after a wheat zoomer first, because I'm looking for intestinal permeability that sets up the whole stage for this. And wheat is a common contributor to bladder dysfunction. I've found it so many times over the years. Is the milk butyrophilins in butyric acid supplements? I don't know. It's a good question. I just don't know about that. I don't think so, but I've not seen a correlation with butyric acid and milk butyrophilins. It may be, but I just don't know. Okay, those are the things that I wanted to answer.
Thanks, Dr. Tom.
Yeah, so Michelle, have you gone through your slide deck or is there a little more you want to do?
Oh, well, we can wrap it up right now. I mean, I could go, you know me, I could go on and on about this topic, and I had, yes, some more information, but
well then,
test, don't gas.
Okay, let me say to everyone, thank you for spending the time to learn more about these tests. And as we started off this 2-hour session with Joe Murray at Mayo saying it's a new era in laboratory medicine. This has never been seen before. This technology has never been seen before. If there are other tests that you are a little in conflict with, should I keep doing the tests that I'm doing or should I try the Zoomers? Just ask your rep on the labs. What's the sensitivity and specificity of your test? Show me. Well, I really don't. I understand you don't know, but go back to the medical director of the lab and show me the evidence of the sensitivity and specificity. And most of the times they won't do it and they can't do it because it's embarrassing. Or they come up with some gobbledygook. Well, our sensitivity is 98 to 100% with comparable tests. You know, they put a little attachment on the end with comparable tests, meaning everybody out there is in the 80 to 90 percentile. So we're within that range of the 80, 90% percentile 97% of the time. That's like saying Kraft, 100% grated Parmesan cheese. It doesn't mean that that's all that's in there is cheese. It means that all the cheese in there is grated. And then there's a bunch of other chemical stuff in that product. That's how they get away with that kind of misleading information. And there are labs out there now that are saying, we have a 99 to 100% specificity with comparable labs. That's not saying anything. What about the sensitivity and specificity in the laboratory, period? What is that number? And I propose to everyone that is a determinant factor in what laboratories you use. Now, it takes a while to change laboratories. It does, you know, in clinical practice, you've got your routine down, all of your prices are in your computers, and There's a comfort zone that you have with a particular test. You have to learn new tests. So maybe you take one patient a week and you're going to do the Zoomers. And then you're going to call Vibrant and have interpretations to walk you through. And you're going to write questions about Dr. Goodhart, who I talked about in the very beginning. He would say, you want to be a better clinician? Take one file home a day. And after dinner, just spend 15 minutes reviewing that file and what you did for that patient that day and what did you miss. Just one patient a day for 15 minutes every day. And you will become a better clinician really quick. So you want to be a better clinician using better testing? Just take one patient a week, a day or a week, run the Zoomers, look at the results, make the recommendations, and notice what happens. Notice what happens compared to the other tests you're using for the same thing. That's the way we improve our clinical protocols, is by reviewing what we do. And we're too busy to do that very much, so you do it 1 hour a week, one patient a week. And pretty soon you're pretty convinced, wow, this is really it. This is a great tool to use. That's what happened to Michelle and I, as soon as we started with this, because we're a couple of geeks, and we both knew of Joe Murray, and I know Dr. Murray, and we know the quality of his work. And so I took it at face value and just dove right in right away. And I've never been disappointed by it. As long as they have total immunoglobulin levels, so the test is accurate. That's the only caveat. So Michelle, so I'll say thank you all very much. And now Michelle's your closing.
Okay, thank you, Dr. Tom, so much. Chat soon. Okay, so I'm going to just wrap it up here, but just a couple things that I wanted to point out. So the cost of the wheat Zoomer to do a 4 Zoomer bundle is twice as much, and you get 4 Zoomers, you get total immunoglobulin panels, which we used to have to send people to LabCorp to order, and you get a free add-on. So, and it's just twice as much. So you're getting 6 tests for the price of basically 2 food Zoomer tests. So it's really, when you explain it to your patients and your clients, they get it. Like, it's really a no-brainer to at least order 4 of these. And then add on that celiac genetic. Look at that price point on the celiac genetics, because I really, really want to encourage each of you to take advantage of this 10% discount for yourself. How can you expect to get your patients and clients to buy in if you can't buy in for your own health? So you take advantage of that discount, run these tests on yourself. You've heard enough about the different Zoomers. We didn't go too deep on the add-ons, but maybe Mary Beth can add a little bit more about that. As to, I think that's the next talk, is how she selects those. But definitely order a wheat Zoomer. If you don't know if you carry those celiac genes and you're in 40% of the population, possibly 30 to 40, that for you, eating gluten could potentially turn on the genes for celiac at some point in your life. Like, eating gluten is like playing Russian roulette. It's not worth it. And once you bought in, it's going to be a lot easier to get your patients and clients to buy in. So I just really want to encourage each of you to do that. And just a pleasure being here, and an honor, and go in health.
Say one last thing. Given that Fasano, with all of his credentials, says the most powerful food trigger in the development of intestinal permeability, which is the gateway in the development of autoimmune diseases, is gluten, which one of you is not going to do a wheat Zoomer? It's a no-brainer.
Yeah.
And when you do it for yourself and your family, and you see, oh my God, I had no idea this was going on, and you address it, and you see the benefits a month, 2 months down the road, no one can argue with you anymore about how important this is. The big picture is that all disease begins in the gut. Practically all disease begins in the gut, the leaky gut. The leaky gut, the primary trigger, the most powerful trigger, is gluten and LPS. So who's not going to do a test that measures gluten and LPS levels? And is your immune system fighting these things? We all get chronic inflammatory diseases. So if you're not going to do the test, it's going to be hard to recommend it to your patients with a sense of sincerity, right? I mean, how can you not do this? How can you not? But in any event, thank you all so very much for being here. It's a real honor to share this information with you. We both look forward to hearing about your experiences with this down the road.